In this video, you will learn how to view clinical images and interpretations. There are multiple ways of viewing the patient's clinical images. If in the exam room with the patient and you wish to view the clinical images, you will select the VI button. VI will allow you to view any clinical images on the patient. Please take note that any new release with MedFlow will change some of your options that you have available. To view the clinical image, you will select the image on the left-hand side of the screen. If you choose the bar up at the top to see a full screen of the page, it will pull the image that you selected. You will notice the toolbar at the very top of the screen to make any changes to the image that you're viewing. The door will exit the image and take you back to the screen that you were just on. If you wish to print the image, you would select the printer at the top of the screen. The arrow will take you back to the previous screen. The ruler is used if you wish to measure a certain area on the image. For example, a nevus, if you wish to measure the nevus, then you can select the ruler. If you wish to zoom in on the image, you would select the magnifying glass up at the top with the plus mark in it. Place your cursor on the image. Move your mouse forward or backwards to make the image smaller or larger. If you wish to zoom in on a certain area, you'll select the magnifying glass. Place your left mouse key down to view the wording clearly. If you've changed the image by using the magnifying glass and you wish to bring it back to the normal view, you can select the reload image icon up at the top of the screen. If you wish to rotate the image, you will use your arrows. Please take note that the image will need to be selected before you can make any changes to it. You'll notice when selecting the image, there's a yellow box lined out on the outside of the image. The T will hide the patient's name. For example, if you've done a visual field and the patient's name is covering up some of the wording, you can select the T button to hide the patient's name. This will allow you to see a grid view. If you have multiple images, it will allow you to see all of the images. This will only allow you to see the single image. And if you wish to compare two images side by side, you would use the two pictures located side by side. If you wish to change the order from right to left or left to right eye, you can select which way you view the image. You'll also notice at the top of the screen the tablet with a pencil. This will allow you to do an interpretation on the image. If logged in as the technician will be able to put in the patient's cooperation and reliability, then select Save. If the doctor's logged in, the doctor can type in the interpretation for the right eye and the left eye and use the arrows in between to move from right to left or left to right. If the doctor has a pick list for the interpretation, you can double-click on the word interpretation and choose from your pick list. You will do this by double-clicking on the selected value and choose OK. Please take note that the interpretation list cannot be configured until you're live with imaging. At that time, we will put in interpretation list. Next, you would select Save, Sign, and Exit if logged in as the doctor. The other ways of viewing the clinical images, if not in the exam with the patient, you would select Technician, View Clinical Images. This will allow the technician just to view the images on the patient. You'll notice on the right-hand side of the screen are all images that have already had interpretations. Another way to view clinical images, if you're logged in as the doctor, you would select Doctor Function View patient clinical images by doctor. If the doctor does not sign the image while in the room with the patient, or the imaging was done at a different time, all of those images are going to populate in the doctor function sign chart screen. All imaging that needs to be signed off on or have an interpretation done will populate under the pending task list for that particular doctor. The doctor will then select the visual field, for example. This concludes the session on viewing clinical images and interpretations. Watch the next session on documenting multiple intraocular pressures.